I am Mr. Bijar, PhD scholar from the Krishna Institute of Nursing Sciences, the Krishna Institute University, Kara. So basically, my research title is Effectiveness of Pre-Visualization on Anxiety and Stress among the hospitalized children facing nursing procedures. So living with the anxiety and stress is like what monster slowly eating at your soul, but finding strength and basically to battle it every day. Anxiety and stress is required at a certain level, but the excessive may adversely affect on emotional status of the child. Current strength of the diagnosis do not harm physically as well as psychologically. To work on this, we created the animated videos of the nursing procedures, which may help to reduce the anxiety and stress of the children. So basically, aim of this study was to assess the effectiveness of the visualization on anxiety and stress level of the hospitalized children facing selective nursing procedures. So methodology for this research was cross-experimental one-to pre-test post-test research design, and it was conducted at Darshan Care Hospital located at Karachi of the Maharashtra state and country India. 200 hospitalized children between the age group of 6 to 10 years using purpose examining technique were included in the study, and children admitted in the hospital age between 6 to 10 years facing selective nursing procedures with the willingness included, as well as children who were physically and mentally ill and will not willing to participate were excluded from the study. Tool was used for this study was demographic data consisted of the age of the child in the years, gender, education status of the child, residence, days of the admission, previous experience of the hospitalization. For the assessment of the anxiety, we have used self-report anxiety scale, which is Wenham Picture Test standardized scale. Second, for the assessment of the stress, we have used children's emotional manifestation scale, which is also a standardized scale, and all the provisions from the inventor of the scales were taken. Ethical consideration was ethical approval was obtained from the Krishna Institute, University, Kara, and informed and written assent was obtained from the study participant, and then consent obtained from the parents of the participant. References are given here. So research shows that demographic data is showing majority of the children, 30% were age group of the 10 years, 58% were male children, 37% children were in the first standard, 52% were residing at a rural area, 75% student participants in the study stated that it's the first day of their admission in the hospital. 78% of the children stated that they didn't have any previous experience with hospitalization. Amongst the 22 that is previously experienced, 70% children were admitted only once in the last year. So the result shows the level of anxiety among the hospitalized children regarding the nursing procedures. So total 200 children we have included. So we have scale like no anxiety, very low anxiety, low anxiety, average anxiety, high anxiety, and very high anxiety. Majority of the children, 73.5%, were in the average anxiety prior to the intervention, whereas after the intervention, anxiety is reduced up to the lower, and they show that 58.5% were in a low anxiety level. Whereas after the assessment of the stress, majority of the children, that is 78%, stated that they are facing high stress performing nursing procedures, whereas after the intervention, majority of the children, 49.5%, stated that they face very low stress. Again, moreover, we have done categorization between invasive and non-invasive procedures. For the invasive, we have selected two procedures, that is intravenous cannulation and IM injection. Whereas for the non-invasive procedures, we have selected administration of the oral medicines, which includes tablet and syrup, and also the second procedure we have included, that is immobilization. So anxiety level among these children segregated for the invasive and non-invasive procedures. Majority of the children in the pre-test invasive procedure. Moreover, that after the intervention, 81% of children stated that they are having average anxiety. But in case of non-invasive procedures, majority of children, they say that 81% they are having anxiety, and 52% are having very low anxiety following intervention. In case of stress, we have assessed. So in intervention procedures, majority of the children face high stress before the intervention, and after the intervention, the stress is reduced up to the 64% with the low level of stress. In case of non-invasive procedures, majority of the children face 80% high stress, and which is reduced up to the 63%, which is fall under the very low stress. So discussion. Similar studies conducted on the hospitalized children into painful medical procedures found that majority of the children had severe anxiety. Also, it was found that there was a significant association between the level of anxiety and the condition diagnosed, children undergoing painful procedures and children on intravenous therapies. A study done by a Siva Rama, she found that in the experimental group, we just findings show that 30, that is 100% of children have moderate level of anxiety, and in post-test 90% have mild level of anxiety, whereas 10% experience moderate level of anxiety. In the control group, we just showed that 30, that is 100% children have moderate level of anxiety, and 26.67% have mild level of anxiety. In post-test 22, that is 73.3% have moderate level of anxiety, and in this study, researchers used the origami therapy to reduce the anxiety and the stress. In the present study, majority of the children have average anxiety 73.5% before the intervention, followed by high anxiety 70%, but amongst all the invasive procedures showing high number of children suffering with the average anxiety, that is 43% and 67%, and high anxiety 53 and 30% respectively, whereas majority of the children's stress level before the intervention was high 78%, and amongst all the procedures, children who face non-invasive procedures show high stress, that's 80%. After the intervention, majority of children shows the anxiety of the 58.5%, followed by very low level of anxiety, that is 36%. But amongst all the procedure, during the invasive procedure, children's anxiety level is reduced and show average anxiety of 81%. Whereas majority of the children's stress level after the intervention was reduced and showed very low level of
Excuse me, sir, sorry to interrupt. You have a time constraint of only 5 minutes. Now it's time for question and answer session. Judges can start the question.
Before that, I would like to conclude this one. So, utilization of the activity nursing procedure videos are effective in the reducing the nursing procedure in nursing interventions related to anxiety